Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, the highlights. Lagos State Commissioner for Health, Professor Akin Abayomi, says COVID-19 management has not distracted the state into ignoring other health concerns. Educationists in Kwara State asked federal government to change curriculum to reflect the need for digital literacy. And India lifts restrictions on restaurants, marketplaces in Delhi following significant drop in daily infections. Thank you for joining us. We begin with an update from the National Primary Healthcare Development Agency and its daily progress on the top-performing states on the COVID-19 mass vaccination campaign in Nigeria. According to the report, the top 3 performing states are Nasarawa in first place, which has vaccinated more than half of its eligible population with 1 dose of the COVID-19 vaccine and 12% of those who have taken the second dose. This is followed by Jigawa State vaccinating 50% of its eligible population with the first dose. In third place is a southwest state, Ogun, with 23% and 7% for the first and second doses, respectively. Meanwhile, Africa has vaccinated only 11% of its population compared to the rest of the world. Here's more on the pandemic update.
87 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT. That's an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 25 infections. Rivers had 16 and FCT registered 15 cases. Delta, Edo, Gombe, and Nasarawa were some of the states with infections in single digits. The total number of confirmed cases in Nigeria has risen to 252,840. This report records no cases from Abia, Plateau, Ekiti, Ogun, Ondo, Osun, and Sokoto states. 267 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 228,404. There were no additional deaths recorded in the last 24 hours, keeping the death toll at 3,134. This report includes a backlog of cases from Delta and Edo states. Currently, there are over 21,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission with over 17,000 active infections, followed by the FCT and Oyo State. Over 14.3 million Nigerians, representing 10.5% of the eligible population, have received the first dose of the COVID-19 vaccine, while more than 5.3 million people are fully vaccinated. In Africa, over 10.6 million persons have tested positive, while over 237,000 deaths have been recorded across countries on the continent. Globally, the total number of confirmed cases have surpassed 366 million, while deaths are beyond 5.6 million.
In Taraba State, the Primary Healthcare Development Agency is lamenting the influence of the elite and professional health personnel regarding vaccine hesitancy as the major challenge confronting them in the struggle for total vaccination exercise. While other challenges, according to the agency, are insecurity, difficult terrains, illiteracy, among others. The Executive Secretary, Dr. Aminu Hassan, reveals that through advocacy campaign, more residents will be vaccinated. He adds that the state has enough vaccines to go around.
Biggest challenge that we face is when you come across a person that is literate, exhibiting the habit of hesitancy, refusing to believe in science, and refusing to accept this vaccine and the reality of the time. That is a source of challenge to all of us, particularly and most importantly, our professional senior colleagues in the health industry. This is a source of concern to all of us because they are supposed to show what we call leadership by example, and above all, believe in science and believe in what we are doing, present themselves outrightly for the vaccination exercise. The hesitancy have now reduced, though there are still pockets of people that still are not yet convinced that this vaccine is okay, is good for them. But I want to believe with the encouragement by His Excellency, with the encouragement by religious opinion leaders and traditional leaders, and above all with continuous information, education that we are doing from the Department of Community Health through the Health Education Unit, through our religious opinion leaders, people are coming out to take the vaccines.
Well, the federal government has been called upon to review the education curriculum to ensure that learning and teaching methods conform with the current realities of the coronavirus pandemic. During the unveiling of a policy brief on the impact of COVID-19 on education in Ilorin, the Brain Builders Youth Development Initiative, a non-governmental organization, implored governments to increase budgetary allocation for education. Following their assessment of the impact of COVID-19 on the education sector, and in the course of research, critical stakeholders, including students, lecturers, education administrators and consultants across the 36 states of the Federation, they discovered that the pandemic had both positive and negative impact on students. They also stress on the need to improve on the education infrastructure and ICT for effective teaching and learning.
We implore the federal government to review education curriculum. This is to ensure that learning and learning methods meet current realities. The federal government is also urged to improve accreditation criteria for higher education institutions. The National University Commission, the National Board for Technical Education, and other accrediting agencies should include digital latency as part of accreditation criteria for higher institutions. Improving digital frontier of higher institutions should not be at the behest of the school management. Rather, it should be a legal mandate for the establishment and maintenance of the institutions. Increase budget allocation for education. The federal government must make a concerted effort to increase investment in education by supporting higher institutions to build digital learning infrastructures. Increase investment in broadband penetration. Nigeria's internet penetration is currently poor. Therefore, the Nigerian Communications Commission must collaborate with the Ministry of Education that higher institutions and their suburb have access to quality internet. We are not saying there's no internet in school now, but of course, it needs to be very quality and meet up with the international standard. Also, NCC must deepen its efforts to implement the national broadband plans to improve internet penetration across the country. For the management of higher institutions, we encourage them to, 1, develop infrastructure for virtual education. Our institutions must invest in digital technology for distance learning. The pandemic has brought a new wave of education system, and institutions are struggling to adapt. Before the pandemic, some institutions in Nigeria had an investment in some digital technology, like the installation of local access network across the campus, investment in Wi-Fi connectivity, and provision of tablets to students. These were done to regularly shift towards digital learning. However, some of the institutions faltered in their efforts before 2020. When the pandemic hit, the available infrastructure was inadequate to support distance learning. Some schools adopted to use social media platforms like WhatsApp for learning, but it wasn't adequate because it could not accommodate a large class and lecturers could not manage the platforms.
And to Lagos, the State Commissioner for Health, Professor Akin Abayomi, says COVID-19 pandemic has not distracted it from managing other health issues. He says even though the deadly virus requires all hands on deck, the state government is also paying attention to other health disorder and will continue to tackle all infectious diseases.
The Ministry of Health has been able to compartmentalize COVID and confine the activities of COVID to 1 or 2 of our several medical institutions, while we allow other general hospitals and other tertiary academic centers to carry on the practice of medicine to address the variety of disorders that we have in Lagos State. So I'd like to congratulate all members of the Lagos State fraternity for being able to keep COVID where it belongs and to allow medicine to carry on. And this also goes testament to the Lagos State Executive Council and the incident command structure that we've not allowed COVID to cause collateral damage. In other words, we've not allowed COVID to deviate us from our medical strategic agenda for Lagos State.
And scientists around the world are making efforts at answering questions about the threat and challenge posed by Omicron. For most, immunity is critical. Omicron has not rewound the clock to the start of the pandemic, but they say uncertainty clouds everything. Well, joining us to talk more about this is Mr. Rahim Toyosi, the President, Society for Scientists in Infectious Diseases, and he's also a medical laboratory scientist. Thank you for joining us on the program. Let's start with testing. I mean, it has never been more important under the pandemic, and frankly, before the vaccines, the world relied on testing. I know that at the beginning we had long testing lines, short turnaround time for results. What's your take on how far we've come so far?
Thank you very much, Millicent, for inviting me. I think so far, Nigeria is doing beautifully well. We are able to move from initial stage where we had just about 2 approved testing labs to a state where we now have over 100 molecular testing labs. I think Nigeria is doing quite well. And we must also give commendation to the federal government of Nigeria for trying to put in place more molecular testing laboratory for detection of SARS-CoV-2 and COVID-19 disease. So for me and for our society, we are doing quite well, but there are rooms for improvement in order to continue to curb this disease.
Mr. Toyosi, some scientists suggest that Omicron is now the speed of the original virus when we had no immunity back in early 2020. What have you noticed from the variant spreading at the earlier pandemic days and this latest variant of concern?
Oh, thank you. When the disease broke out in 2019, what we had at that time is a type of SARS-CoV-2 that we take as the original type of coronavirus that is causing the COVID-19, which is SARS-CoV-2. Between then and now, we have witnessed several variants of concern according to the WHO. And initially, what we had was alpha variants. Thereafter, we have the delta, the beta, the delta, and gamma. And for now, we are battling with the Omicron variant of the virus. What informed the changes over time? There are so many reasons for that. The virus, as we all know, continually mutates, just like any other virus pathogen. There is that tendency for mutation, and the mutation means that there are some genetic variations in the code of life, that is the nucleic acid of the organism. And because of these changes, we have had several types of mutants, different from the original one, which we call the wild type virus. So we are battling currently with the Omicron variant of the virus, and that is where we are.
In terms of perhaps some of your data, research, epidemiology updates on Omicron and the future of COVID-19, what would you say is going on?
Well, the truth about viral infection, and in fact, any infection of that nature, is that the pathogen, the agent of any disease, continually mutate based on certain determinant that is existing at a particular time. And that is why Society for Scientists in Infectious Diseases are really of interest, are concerned with the future of some of these pathogens. But since we are talking of Omicron, our concern, for instance, is that if care is not taken, diagnosis will become difficult because as changes are happening in the target structure of the pathogen that we are using to detect or to investigate the disease, as long as variations continues, mutation continues, detection will be a challenge. Even outcome of vaccination will also be a challenge. And that is why we have a serious interest in the dynamics of this mutation and what we can do to continue to put the disease, to continue to curtail the disease, because we know that mutation and variation in this pathogen is something that we have to contend with as a result of certain determinants which are happening even without us knowing. These determinants are many, including environmental changes and even changes in the host where the pathogen is causing disorders.
All right, Mr. Rahim Toyosi, the President, Society for Scientists and Infectious Diseases, also a medical laboratory scientist. Thank you so much for joining us on the program. Hopefully you can join us again.
Thank you for having me.
Still to come, health expert in Jigawa State cautions on continuous use of the COVID-19 safety guidelines. Please stay with us. There is need for people to get vaccinated and continue to adhere to the COVID-19 protocols despite achievements recorded in the fight against the deadly virus. This is the opinion of Ishaq Mohammed, a member of a civil society partnership working for health in Jigawa State. According to him, the Omicron variant of the virus spreads rapidly, hence the need to redouble efforts to curb it.
Many people within the, let's say, like the rural areas, even in the urban communities, you'll see some people are still trying to reject the vaccine, of which is not a good practice. And also regarding the COVID-19 protocols, adherence, people are just somehow adamant about that. You can see people still gathering in very high number, trying to be not using the face mask, this very face mask, and also the hygiene, that is hand washing and the rest. We have gone through a lot of stages in terms of COVID-19 with different variants from the Delta, the rest, and we are now in Omicron variants. People need to do much on the prevention measures, and also people need to take their vaccine, because this is the only way you can be able to combat this this pandemic.
Away from Nigeria, according to the health minister, Germany's surge in daily COVID cases remains under control despite a string of new infection records. This is from the country's health minister. He told reporters in Berlin that the infection rate among the elderly, many of whom remain unvaccinated, is much lower than the average, and that so far the Omicron variant surge is slightly below projections. This week alone, the country's disease control center, the Robert Koch Institute, registered more than 203,000 new cases in one day, Thursday. Cases also rose by a third from the same time last week. Deutsche Welle correspondent Chiponda Chimbelu joins us right now from Berlin for more. Hi, Chip. Why is Germany struggling to get the pandemic under control?
Well, one reason Germany is struggling to get the pandemic under control is testing. When it comes to testing, we've seen Germany not testing in terms of the more accurate PCR testing as many people as, say, other European countries. If you compare to a country like Austria, there you see around 89,000 people being tested for every 100,000 people in terms of PCR tests. You look at a country like Denmark, it's around 50,000. France is around 13,000 per 100,000. Germany is at 2,000 or around just over 2,000. Now, that is, of course, far behind these other European countries. And that is an issue because, of course, PCR tests are more accurate and they can help us get more reliable data. And, of course, the authorities have decided to also limit the number of people who can be tested with PCR tests. And that would be now only health professionals or healthcare workers and people who are in vulnerable groups. So they will be the ones who will be able to get PCR tests. The rest of us need to rely on antigen tests, which are, of course, less reliable. So that's the issue. Testing, and of course, not just testing, there's also vaccination rates. The German vaccination rate is hovering just over 70%. It's around 73% right now. So it hasn't moved much higher from where it was in December, which was around 69% early December. So that is an issue, vaccination rates, and of course, testing.
German lawmakers also debated the vaccine mandates. What would that look like, and how essentially is it being received?
Well, in terms of a wider vaccine mandate, Germany is talking about getting a wider vaccine mandate for anyone 18 and over. And that is definitely what they're looking into. There is a vaccine mandate for healthcare workers because, of course, they come into contact with patients. But they want to expand that potentially to the adult population. And that's where part of the argument is, of course. Does it make sense to have a vaccine mandate for people who are in their 20s or 30s who are not, of course, as high at risk for getting COVID complications? So some people feel that it should only be for people 50 and upwards. That's part of the discussion. Another part of it is also, how do you check who's been vaccinated or not? We don't have a vaccine registry here in Germany, so that's also an issue. Just how do you check? So those are some of the issues that were debated in the German parliament, the Bundestag this week. And of course, we don't have any indication as to when the wider vaccine mandate will take effect and exactly how it will look.
Finally, Chip, how does the current situation in Germany compare to the rest of Europe?
Well, compared to the rest of Europe, Germany is not looking very good, at least compared to countries like Austria. Austria already has a wider vaccine mandate for the population, or for the whole population, and that is taking effect in February. So next week, it will be in effect. And Austria will also be able, like the authorities there, will be able to check if someone has been vaccinated. And if they haven't, they will be able to fine them up to 3,600 euros as of March. So that is one example. And you see countries like England, of course, lifting restrictions. England decided that masks weren't mandatory everywhere in the country, in public spaces. And countries like Finland are also, getting rid of the restrictions. France gave indications as to when it may lift some COVID restrictions in February. Here in Germany, we're not yet at the point where the authorities are telling us when that will happen. So Germany seems to be a bit far behind, and that is definitely part of the concern when we look at the COVID situation here.
Well, let's hope that, it is soon, the lifting. Many thanks to Chiponda Chibelu, the Deutsche Welle correspondent, joining us from Berlin. And to other stories, the Indian capital, Delhi, has lifted its weekend curfew as the Omicron wave slows. Now, under the new orders, the city will remain under nighttime curfew and schools will be closed. Restaurants, bars, cinemas in Delhi will be allowed to operate with up to 50% capacity, and the number of people at weddings have been restricted to 200. Here's more on the global update.
India's capital, Delhi, has lifted a weekend curfew and is now allowing restaurants and marketplaces to reopen following a sharp drop in new infections of COVID-19. Under new orders, however, the city will remain under nighttime curfew and schools will be closed, as government data suggests India's recent Omicron variant outbreak has slowed. The data shows the number of new cases in Delhi fell to 4,291 on January the 27th, from a peak of 28,867 on January the 13th. More than 85% of COVID beds across the city's hospitals are also unoccupied. North Korea has tightened epidemic prevention measures, with officials seen disinfecting barbershops in the capital, Pyongyang. Customers also have to undergo body temperature checks and adhere to social distancing. North Korea has not reported any cases of the coronavirus, but has imposed lockdowns and quarantines. The The EU's drug regulator has given the green light to Pfizer's Inc.'s antiviral COVID-19 pill for treating adults at risk of severe illness, as the region scrambles to boost its arsenal to fight the Omicron variant. The endorsement by the European Medicines Agency for a conditional approval, if followed as usual by the EU Commission, allows member states to deploy the drug after the regulator gave guidance for its emergency use late last year. Italy, Germany and Belgium are among a handful of EU countries that have bought the drug, branded as Paxlovid.
Remember that the COVID-19 is not caused by a bacteria, but a virus. So antibiotics should not be used without prescription to avoid antimicrobial resistance. Visit our websites for more updates, a better understanding of the pandemic and other stories. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.